Welcome again. So we did the warm up. We're going to talk about lecture. So today we're going to actually focus on your next assignment and also the SWOT analysis, which is the next one. So it's building on the technical assessment of integrating learning technology and then going into the specifics of how to do an assessment of making sure that you can integrate that technology into the organization. So once again, we'll have like a brief overview of the organization culture, technical assessment that you are doing. So far, time is flying. Next week is going to be October. So the main focus of our lecture today is going to be SWOT analysis, and then we'll take a break and then go into our small groups and apply that concept into what we are doing. So some of you, SWOT analysis is something that all of you have done or not many of you have done. In some cases, it's just an evaluation, and SWOT is stands for different words. So yes. So what is SWOT analysis? It's a tool. It's usually a standard tool that is used in many different organizations to evaluate organizations' internal and external environment in 4 different areas. I know in one of my other areas of expertise is program evaluation. So SWOT is one of them. Another one, there's different models that have come out after SWOT analysis. There's another model called SOAR analysis, SOAR, and it's more aspirational, meaning that instead of using weakness or threats, they use a different terminology. So they're different models, but for now, we're going to use the most popular model, which is the SWOT analysis. So S stands for strength, W stands for weakness, O stands for opportunities, and threats. So as I'm lecturing, what I would like for you to do is think about your assignment 1, assignment 2, and what you're working on right now, assignment 3. So when you think about SWOT analysis, what does S mean? Strength. What you're doing is internal attributes that provide advantages. So remember, SWOT analysis is not only applied in learning technology and organization change, it could be applied to anything that you can think of. Weakness, it's internal attributes that hinder progress. So we're looking at the pluses and minuses within the organization. So that's one of the reasons why I've asked you to think about the mission, vision, the strategies that your organization is utilizing in order to understand how you're going to introduce this learning technology or new innovation into that organization. Opportunities. This is when you're thinking about external factors that can be leveraged for success. And then threats. What's going to cause you to not be able to implement this innovative technology? So external factors that could pose risk to adoption. So these are 4 areas. So SWOT analysis. So as I'm talking about these, I want you to think about the organization and the technology that you have chosen so far to integrate into your organization. So why is SWOT analysis so important for, especially for tech adoption? It's going to be very important to evaluate if the organization is, for instance, ready for AI. We're talking about AI just because the example that I'm using is integrating AI into public health or other emerging technologies in your organization. You also have to identify the internal strength and weakness, as well as external opportunities and threats that impact the adoption. So you have to do both internal and external to make sure that the time is well spent and you're doing the research that you need to in order to move forward. So we like to always start with our strength. Why do we do this? Like I said, we are making a list of all the strength for this assignment. Like I said, you have to put it into beautiful prose later when you are coming up with your final proposal. But what I would like for you to do is think of strength as one area and all these different areas and make a list. And then, of course, you also have to show evidence, meaning this is an academic setting where you're trying to convince what you need to be doing in terms of your audience, your stakeholders. You have to convince them why this technology is important to integrate and what is the evidence. So, like what one of your classmates asked, like what articles or what evidence or what do you have to look for when you are trying to convince your stakeholders, your audience, people who have the money? So you want to look at internal resources or capabilities that support the technical adoption. So it's always good if you have a group of people who are well-versed in technology, or if you have internal resources. Those of you who worked in government, as you know, as the deadline comes close, there's a lot of spending you have to do. It's like lose it. If you don't spend it, you lose it kind of thing. So there's a mad rush to spend in September, especially if October 1st is the deadline where it resets, especially in government settings. Sometimes we go by annual calendar year where there's, like I said, a lot of resources at the end where you're saving and then all of a sudden you have to spend it. Anyway, internal resources and capabilities. So this is where you are, hopefully you have a team of people that you have together to brainstorm about the organization. However, if you've been at the organization for a long time, you may have the institutional knowledge and also be in a position of power and also in a place where you can make decisions to make that list and figure out who the key players are and how to build capacity and what internal resources that you may have. So what are some of the questions that you're going to ask? So go back to your organizations. Like I said, some of you are looking at government agencies, nonprofits, schools, higher education, for-profit, nonprofits, small businesses, etc. So there's a lot of different places where you have to think about these questions, but what are some of the existing resources, capabilities, and skills does your organization have to help you with adopting technology? So a lot of times, if you have the resources and technology, it means, remember, everything costs money. So if you could save the organization money and it shows that you are utilizing your people, also your resources in various different ways, it's going to be a plus. Are there specific cultural elements that align with adopting cutting edge technology? So I told you that in public health right now in the field, roughly about 60% of the people working in the government agencies are retiring. So you can understand that there's a huge generation gap, meaning a lot of the folks in public health have not grown up with technology. So there may be a digital divide where, let's say, if you're adopting AI in public health, there may be an opportunity or a weakness depending on who you're talking to. So what are the cultural elements? Maybe if you're in California and the Silicon Valley folks are donating, millions of dollars to, let's say, certain health departments, there may be an opportunity there to try out some cutting edge technology. How does organization structure support technology adoption? Meaning, what kind of structure? Remember, I told you to think about your organization. Is it a flat structure? Does it have more of a hierarchical, old-fashioned structure? Is it, what kind of structure do you have in terms of making decisions? And you also have to think about the strength you identified in assignment 1 by analyzing the organization culture. I know some of you mentioned that your organization is very agile. They're willing to try out different things. There are some organization, for instance, meaning they may be more comfortable doing things in a traditional way. So you have to think about the strength and realize what's there in order to move forward. So think about the strength and then moving forward. So some of the examples that I could give you is, does the organization have a high IT department with experience in data-driven health initiatives? So some departments, for instance, when I worked in Delaware as a state epidemiologist, they were one of the pioneers in working with biosurveillance. So they had a huge IT department. And unlike many of the states, the state of Delaware was very small, so they only had one department for the whole state. As opposed to Texas, you have the state health department, they have a county health department, and then you have different city departments within. Therefore, sometimes integrating new technology could be very, very difficult. So you have to think about the organization and also the skill set. So University of Delaware was right there. And so there was some incentive for a lot of the public health students to actually spend some time in Department of Public Health to get some knowledge and also some benefits as well. So what are some specific cultural elements? So there are organizations that might value research and innovation. So meaning there may be some organization where AI is not seen as this fearful technology that's going to take over everyone's jobs, because that's one of the fears that people have in terms of, oh my goodness, the technology is going to take over and is going to do everything. But there may be strength, meaning there may be people in the department. So the example I'm going back is the public health department that is seeing that after the pandemic, we're seeing that technology is so important. We are able to get the GIS data, the outbreak data, all those things all at once, social media data, and we're able to kind of crunch all that number very quickly utilizing technology. Another thing that we can talk about is telehealth, for example. That's one of the things that we talked about in terms of people were not lukewarm about telehealth, but as soon as COVID hit, there was a mass adoption of technology. So there may be some opportunities where certain historical events may actually give you the strength and opportunity that we're going to talk about later that will give you the opportunity to start thinking about this as a strength. So your stakeholders or your clients or your patients, your students are very comfortable using technology. So previous experience with digital health can definitely work in terms of adoption of new technology, for instance. Another thing that we want to talk about is looking at the organization structure, how we talked about certain different organizations, it may be centralized. So UIW is actually a centralized structure as opposed to decentralized organization, meaning it's different states, different counties may have their own jurisdiction on what they can do. So think about where is a decision made in terms of in your organization. So some of you are entrepreneurs, so you may be the boss who can actually make all these decisions. You have the purse and the decision power to implement. Some of you are actually somewhere in the middle management position where you have to convince people below you and also above you to figure out what you need to be doing to adopt this technology. And some of you may be sitting in the C-suite making all the decisions as well. On the other hand, you may not have any decision power. That doesn't mean that you don't have any influence, but there may be some things that you can do to convince people to utilize and think about the adoption of this new technology. And so when you're thinking about your organization, so going back to the strength, think about the resources and skills and capacity that your organization have. So I just put AI for now, but technology, anything that you want to adapt, meaning in terms of learning technology that you want to incorporate, think about the skill sets and figure out what kind of resources, and also think about the cultural elements that may align with embracing new technology. So you want to go back to the mission statement, vision statement, as well as the company's strategic plan to figure out, are they ready? Is this something that we can introduce, or we may have to do something else to move forward? So as we focus on the strength, we also have to look at the weakness. And this is actually very tough on the strength, especially if you're in person or if you have a hybrid meeting where you're jotting things down. The brainstorming session is great when you think about the strength. Weakness sometimes brings up some personal anxiety at times, just because I think a lot of times when we think about the weaknesses, we're looking at the organization weakness. However, a lot of times when we talk about something negative or something that is seen as critical, we tend to automatically personally attribute that weakness. So one of the things that we need to do is we need to think about the organization and make sure that you create a safe space for people to talk about the weakness of the organization that's going to hinder you from adopting the technology and the process that we need to be engaged in. So what are some internal barriers that could slow down the technology adoption? So meaning you want to look for some of the pain points where you've done all these hours of work to get to do the organization assessment. You think about the culture, you've done the technical assessment. Now you're looking at this whole organization and implementation. What is going to be that barrier? So what are the specific, so some the questions are actually going to mirror what you saw in the strength, but what are the specific cultural or structural barriers to adopting technology in your organization? So for example, let's say the president is old-fashioned, he or she or they are not familiar with technology and they don't want to endorse it. Or it could be a cultural barrier where, meaning that a lot of the folks are fearful of technology. Or it could be various different things where it may be not just cultural, but structural barriers where we signed a 5-year contract just recently with another company, and it's just you guys didn't think about some of the innovations. So AI didn't really get introduced, although it's been around since 1950s, 60s, it hasn't been in the public domain until a couple of years ago. So does the organization structure hinder efficient decision-making? Those of you who worked in government, military, government, state, federal, etc., takes forever sometimes to get the approval, right? So even in higher education. So are we going to miss the boat when we're waiting for the decisions to be made? And are there skills or knowledge gaps in the workforce that might make the learning technology adoption more challenging? So it looks really good on paper that we want to adopt this technology, let's say, for instance, public health and AI, but is the workforce actually ready to use it? If it's installed in every single computer in the organization, would anyone use it, right? So for example, public health and AI, even a well-funded public health organization, there may be some silos, meaning that they may not be very, very comfortable making that decision of adopting technology. So this sometimes becomes a weakness, meaning certain departments are working on HIV, certain departments are working on flu, or certain departments are working only on chronic diseases or climate change, et cetera, but they're all interrelated. So the public health workers may need to be familiar with some of the AI systems. So you can introduce the technology, but what happens is you also need to provide that training that's going to allow the students, the workers to utilize the technology. So for instance, we have moved from Zoom to Teams, as you notice at UIW. And there's a lot of growing pains because I know for me, I've been using Zoom since 2014, and Zoom is very comfortable and intuitive. Teams, on the other hand, I know I've used it. However, it's taking me a longer period of time to get used to. So same thing with introducing new technology. It may sound really great on paper, and for a select few who have actually decided to choose this technology. However, what are some of the weaknesses and case studies that you can look at where the other technical integration may not be the best idea? What other things that need to be in place for us in order to adopt technology? So these are some of the questions that you have to ask. And like I said, just going back to the example that I started off a couple of weeks ago with public health and AI integration, like I said, it hasn't happened yet. The CDC is using AI for some of their analysis, but it's not something that is adopted all across the nation just because we have some issues. So once again, even with the well-funded setting, there may be some issues as we try to convince people to use AI. So what are some of the questions to ask in the context of public health and AI, let's say? So is there resistance to AI because employees are concerned it might replace human jobs? So some people who are doing more of the repetitive work, they may be fearful. Therefore, they may be voicing out some concerns about adopting new technology. Another thing is if you adopt this new technology, is it going to take a couple of months? So is it going to take 3 months, 18 months, 2 years? And like what we mentioned, older generation or people who are not digital natives, are they fearful of that technology? So yes, I am going to, like I did in the other ones, yes, and lack of skills. So a lot of times what's going to happen is people who've been, for me, my experience working in the state government for public health is that a lot of the folks have gotten into public health, not because they have a degree in public health, but they stumbled into public health arena and started gaining their job skills, doing outbreak investigation, doing data analysis on the job. So now that you are introducing these new tool sets, it's going to be very important to make sure that you're providing not only the technology, but also what is that learning gap? So as educators, you need to think about, okay, in order for us to get here, what do we need to do? So what are some cultural and structural barriers? So in our case, AI adoption or technology adoption and organization structure as well. So I sound like a broken record because a lot of times what we do is we may have wonderful plan in place, but you have to think about the human factor, meaning the organization structure, some of the unwritten rules that you'll never going to get out of AI or reading the manual or the policy or anything that's on the website for the organization. It is very pretty and public facing, but you really have to know your organization in and out. or have a trusted advisor of people who can work with you to tell you, hey, there's going to be some resistance at this point. So let's say out of your department, there's going to be an approval process that in the middle that you need to actually convince and show evidence. So for example, the finance, they want to know how much it's going to cost them. So they want actual numbers, not just theories that it's going to work well, but they want actual numbers and projections. So these are some of the things. And like I said, the board of directors are going to be concerned about A, B, and C. So these are things that you can only tell from organization, culture, structure, knowing the mission, vision, and also being there and having some of the inside knowledge in order for you to get the technology. So for example that I gave you is integrating AI in public health workforce. How do you do that? It sounds amazing, right? Efficiency, 60% of the workforce is retiring. Therefore, we need people to do the work. It still has to go on, essential public health services. But how do you do this, right? It sounds wonderful. However, there's going to be various different concerns that we're going to talk about, ethical concerns. What is getting put in? What is getting put out? Who has ownership to the data, et cetera. So there's a lot of concerns about utilizing and also integrating technology. So that's one of the reasons why I'm asking you to kind of sit down, think about which technology that you are proposing, what you're going to be doing, and how you're going to do it, but in the greater context of what you're doing. So in one context, it's going to work really well. In another context, it's not. So I am, so coming back to the third part of the SWOT analysis is O, opportunities and analyzing external factors. So basically, it's usually a 4-quadrant if you've done SWOT analysis before. So you do the internal strength and weakness, and then now opportunities, analyzing external factors. So what is the objective of doing opportunities? We're looking at outside forces that will help improve the organization performance and facilitate technology adoption. So one of the key factors for all of us is the historical COVID pandemic. COVID pandemic actually opened a lot of opportunities in education and in medicine and public health, just because we weren't able to meet face to face. So technology was the interface that we had to use to communicate. So what are the factors that can accelerate technological adoption? And so you have to look at external trends like funding opportunities or technical advancements that you can leverage. So for me, in the early 2000s, there was a whole big move for a lot of the funding in the government for obesity reduction. So one of the focus in my research was actually obesity nutrition, worked with a lot of sports exercise physiologists and kinesiologists. There was a lot of funding because everyone was talking about obesity, diabetes, obesity pandemic, etc. So now when we look at technology, some of the external trends that you would see, of course, one being COVID pandemic, marks an opportunity. And also another external trend that you may see is wearable devices, or it could be new technology, who knows, whatever the opportunity is. And you want to see what external trends or things that are happening. So another external trend would be it's an election year. Therefore, there may be some factors in which some candidates may actually like to align themselves with innovation, technology, etc., depending on their platform. So it's not just generic, external trends. You're looking at, I know some of you also mentioned psychological factors too. There may be psychological, economical. There's also health. There's various different areas of trends that you can look at that you can leverage technology. Or you may actually know that there's a big donation. So for example, I don't know if any of you work in Alamo colleges here, but Bezos' wife or ex-wife donated a lot of money to community colleges. And one of the recipients of some of that donation for community college, believe it or not, is actually one of Alamo colleges. They received some millions of dollars from their foundation. So there may be some external trends that may actually help you to leverage and introduce that. Are there societal or industry changes that is making technology more acceptable? Of course, there is with the introduction of internet, social media now. I actually had an opportunity to try out Vision Pro. I just thought it was a hype because I do have Oculus and all those different technology, because one of the things that I'm looking at is creating like virtual reality classes where, especially some of you who've been in the military or been in jobs where you travel a lot, that you miss being in that physical environment. Like I prefer to be face to face with everyone. However, depending on your situation, online or hybrid platform is just as good as long as you know how to use that technology, right? The faculty has to know how to use it, and also the user, students have to know how to use it and feel comfortable. So I am going to you recording. So another thing in terms of opportunity is trust in technology. So how much trust is there in terms of adopting and implementing technology? And is there a perfect time to leverage technology for faster, for example, disease detection? So the pandemic allowed us to utilize technology to detect and also use technology to mitigate some of the risks. And is there opportunity to collaborate with external factors to strengthen technology adoption? So for instance, a lot of academic centers are partnering up with OpenAI. I know I was talking to a colleague at University of Arizona, and I heard that they are partnering up with some of the AI companies to do some of the integration of AI chatbots and all that stuff into their curriculum. I think Hopkins is also doing some AI and integrating that, and all the faculty members are getting trained to utilize AI. There's a couple different institutions that are partnering up with, and Stanford is one of them, in terms of they have innovation labs where they're trying out. And I think that's where I was able to, that's where I heard about the virtual classrooms and reality classes during the pandemic, because we were stationed in California and Northern California. So I had the opportunity to meet a lot of these innovative technology folks through my alumni group, where a lot of them were working in a lot of these tech firms in the Silicon Valley area. What external opportunities could you accelerate technology adoption in your field? So all of us come from different fields. Like I said, I've been trained in so many different fields that from social sciences to hard sciences or biological sciences, where there's commonalities, but also there are differences, meaning the discipline of education, their theories versus, let's say, in what Dr. Helen, when she came, when the school of thought for pharmacy is very, very different, right? So being precise, right? In terms of, there's no gray areas in terms of measuring out your prescription, right? Versus education, there may be some gray area as well. So you want to look at external opportunities. So if you're in the school pharmacy, there's going to be pharmaceutical companies that you can work with. On the other hand, for education, we may have some firms that are even like news companies such as PBS, any of the Khan Academy, let's say, there may be different opportunities that you can work with to be part of their solution as well as partnerships. So going back to our AI example, and also in terms of telemedicine, the telemedicine has been around for a while. And especially in the military, in the VA, they were using telemedicine. And then during the pandemic, there was a wide adoption of telehealth just because the regulations that restrict the use of telehealth were lifted during the public health emergency, and it was widely accepted. So what happened after the pandemic is American Medical Association, a lot of the health professional organization lobby to keep telehealth as part of their repertoire of tools to work with patients. So there's a lot of lobbyists and also people who are advocating for making sure that telehealth is part of the treatment plan. So what are some of the external trends? Government may be launching a grant. So for example, there's a lot of talk about AI right now. So even World Health Organization, UN, all the world organizations, as well as different governments, are very interested in understanding AI because we know it's the wave of the future. And how do you work with the government? So there may be RFPs or there may be fellowships that are out there that is enticing organizations as well as students and also people in different career fields to come work on it. There's also post-pandemic acceptance of telehealth and medicine, for example, which opens the door for other technologies. So I'm going back to those of you maybe old enough to remember this, but if you remember some of the commercials that you saw when you were growing up, they talked about marijuana or pot being the gateway drug to everything else. So as a public health professional, the reason why I'm saying this is because telehealth is actually opening doors, or technology or the pandemic is opening doors for other integration of technology. Now people have utilized it. It didn't cause any harm per se. And of course, like I said, there's different schools of thoughts in terms of telehealth, meaning you have to see the patients first before to ensure that, you know the patient, it's not an avatar, etc. So there's various different checks that you have to do. But what I'm trying to say is the environment and the opportunities there for us to introduce other technologies. So what external trends and resources that can be leveraged? So you have to think outside the box, meaning you can't just look at the traditional funding sources or a traditional folks. Who knows, maybe McDonald's have money and they want to go into the automated, they already have an automated system, but they may be looking at other things, right? So how does societal or industry changes create opportunities for technological adoption? So for me, I'm waiting for the day, like I said, some of you, it might not make sense, but if you remember Jetsons, the cartoon, I'm waiting for Rosie, the robot who can clean, does everything in the house, and we're not quite there yet. But we need to see what the trend So for example, Japan, or in some places in Korea, for instance, they are more likely to adopt more newer technology just because the technical advancement for those countries and the cultural acceptance is a lot higher than some other countries, right? So you have to look at the surroundings, what other opportunities are there. But of course, there are threats. So when there's opportunities, remember, it's cost benefit analysis. Whenever you choose one choice, there's always going to be some other threat that might actually prevent you from adopting the technology. So what external factors that can derail or slow down the process of technology adoption? So one thing is, I know some of you allude to this, is external regulatory or regulations or laws or policies that are going to prevent you from implementing. Also being competitive. So it might be too expensive to implement at this point. So think of some of the super processing computers that exist today. It's right now we can afford it, but let's say 30 years ago, none of us were able to afford it just because it sat in government like NASA or some of the other government facilities or places, organizations that can afford these expensive tools. Or societal factors that might impede technology adoption. So meaning there may be people who are against technology or they think they're going to take over. If you like sci-fi, a lot of times the future looks very bleak. A lot of times robots are taking over our lives or our planet gets destroyed by artificial intelligence, etc. The future is very dire when you introduce technology. Especially in the fiction or sci-fi fiction. So what are some of the, yes, Terminators do, very good. So exactly. So you have to look at regulations. So going back to, and I'll give the example again, think about telehealth. It had a lot of benefits, but there are some regulations and rules that is preventing a wide acceptance of telemedicine and telehealth. What competing organization or industry may be faster in adopting AI or or technology, giving them a competitive edge? So, for instance, Microsoft, OpenAI, Google, all of them have infrastructures that will allow them to adapt and also pivot. Their AI platform, Gemini, I think, is their tool to augment and also pivot pretty quickly compared to people who don't have the technology. Amazon is actually another one because they're collecting a lot of data from us and they're able to utilize that data to pivot. Especially if you go to their site, they have your whole shopping history. So when you go to Amazon, what happens? It gives you, you may like this, you may like that, because they know they've been tracking you all this time to figure out what your preferences are. So once again, some of the threats are any mistrust in how the data is handled, and can it lead to resistance? So it is good to be mistrustful or not fully trust everything, especially if we talked about how right now the AI systems are proprietary, meaning it's not transparent. We don't know what data is going in, what formula that or models that they're using to give you the results. It's not transparent. Are they also using our data and selling it or using it for other purposes? I know when you go to the website, and I'm guilty of this too, where they give you, there's a cookie or a pop-up menu that comes up and it has lots of small letters saying something about your data use, right? So in Europe, they have a stricter regulations than United States, but in United States, you have to opt out. So for instance, LinkedIn, they just instituted something where you automatically get opt-in to their AI generator, meaning if you don't opt out, all your data, what you're posting, what you're looking at, it gets all tracked and gets stored into their LinkedIn database that you and I don't have access to, but the employers do. Are there any societal or ethical consideration that can trigger resistance to technology? So one of the things that there's a big concern about is, especially for health data, is once the big companies have this data, especially insurance companies, are they going to create models that are going to actually create predictive models where they give you risk factors? So just because you have history of heart disease, obesity, diabetes, etc., are they going to create models where they're going to increase your premium just because your likelihood of using insurance is a lot higher than someone without this history? So there's some ethical concerns. Self-driving cars, if the self-driving cars go into an accident, is it the people who coded the AI, or is it the company that provided the car? Like, who's liable for the accident, right? So there's all these different ethical consideration, but without knowing the fundamentals, you can't make these decisions. So you probably notice a lot of times policymakers are making decisions based on best information that they're getting from their subject matter experts. And a lot of times you really have to surround yourself with good advisors because you have incomplete information. What external threat does your organization face if you delay or complicate, like, for instance, AI integration? So if you read a lot of business books, and like I said, for me, I like different disciplines just because for me in public health, one of the things that happens in a lot of public health organization is we run out of money. We usually get like 5-year grants to do these great programs. However, there's no sustainability just because we're competing for another grant funding. However, the academics, and of course, this is just generalization, is we don't have an entrepreneur mindset. So once we start the programs can't sustain themselves. It doesn't make profit. You need external sources. Therefore, once you get the funding, you have to automatically think about when the next funding cycle, like you have to make sure that you have another funding coming in. I'm on their board for a lot of different organizations. And right now there's a lot of government funding cuts for CDC, NIH, and all these organizations that give a lot of funding to a lot of nonprofit organizations. But now with different regulations, there used to never be restrictions on how many grants you can apply to these agencies. However, they decided to actually limit how many grants that you can put into these agencies, which means that if you like math and statistics, if you limit the number of submissions from an organization, your chances of getting the grants get smaller just because your chances get smaller in terms of who gets picked. So a lot of times you have to think about your threats, meaning where is the next funding going to be? If you miss that opportunity, are you going to have more competitors? So if you're one of the first ones to hop on the wagon, there's no competition. And so, however, if you hop on the bandwagon later, you're competing against hundreds of people as opposed to just 1 or 2 or 10. So what you want to do is think about 3 external threats. So a lot of times, if you go through the strength, weakness, opportunities, and threats, I want you to think about at least 3 threats, 3 opportunities, 3 strengths all the way through. If you could think of more, that's wonderful. If not, think of some more because there's always 3. So AI, one of the concerns with AI, especially integrating AI in public health, is the data privacy concerns. So even if you can track diseases, so one of the examples that I can share with you is this: sexually transmitted diseases. So you think it's a young person's disease, but one of the things that I was tasked with as a state epidemiologist was the fact that there was an outbreak of STIs, so it used to be STDs, in a senior living facility. So we were trying to figure out who the patient zero was, who was the culprit that was spreading. So the thing is, it becomes an issue, right? Because it is a very sensitive issue. It has there's different implications, right? But who's getting that data if we integrate AI? Do we have the technological know-how to have a closed system where only people who sign contracts that says, we're not going to say anything to anyone, etc. But the thing is, it's one of those sensational news that if it gets out into the, news world, people want to hear about it, right? So additionally, there's public mistrust in how the data is handled can cause resistance. So if the AI is trained wrongly with the bad data set, it might hallucinate and say that there's an outbreak in certain areas that is not plausible, for instance. So you really have to think about the where the data is going, what you're doing with the data, and how much information is given to the public. Because right now, the trust, especially with the CDC and public health, is very low. It's probably one of the lowest that I've seen during my career, is because of lack of communication and transparency. So external things that you have to think about is new regulations on data privacy can cause legal challenges, meaning some states may require, so if you are implementing telemedicine, some states require that you need to see the patient in person at least 1 or 2 or 3 times before you can use telehealth. Or there may be some regulations where the provider and the patient has to reside in the same state where the doctor has his license. This is not the case for federal government or VA, where it's federal, so it doesn't matter. But in each state, regulations and policies are very different. So could competing organizations or industry be better in terms of adopting? Yes, there's some organizations that can adopt AI faster. So private institutions as opposed to government institution may, as opposed to some of the other organizations. And then in terms of societal, like I said, ethical consideration, if you're looking at going back to public health data, one of the famous studies in public health is Framingham study. If you look at the Framingham study, the results are remarkable. I mean, you have not seen such a comprehensive data set longitudinally, meaning they follow these people from point 1 all the way to many decades. However, if you look at the population that they studied, it's not diverse. So the conclusion that you're getting from that data, and if AI is using that data to extrapolate and do a prediction model, it's not going to predict well for someone like, myself, or someone who was not in Boston area, right, in terms of the population. So there's some data concerns in terms of threats. And that's one of the reasons why it's going to be very, very important for people like yourself who are subject matter experts in your area to decipher what AI or the learning technology is given. So you always have to look at regulation and policy. I know a lot of people say, hey, I don't want to talk about politics. I don't want to do that. But in our line of work in education, if you're in health or any finances, regulations and policies are going to matter, because you want to know how things work and how you can go about implementing and getting the right licenses and clearances in order to utilize that? Are there ethical concerns that could cause resistance? So many of the ethical concerns are going to be very valid. So you want to make sure that you are taking into consideration ethical considerations when you think about threats and opportunities. So what are some key takeaways? So I have a couple slides and we will go into groups. Is how can organization leverage strength to support technical support? And then how can weaknesses and threats be mitigated? So if you're presenting weaknesses and threats, you want to give solutions. A lot of times when we do a SWOT analysis, we give all the facts, but I think if you're presenting to a stakeholder and if you're trying to get money, not only it's one of those questions. I don't know how many of you have gone through interviews. I know every couple of years I have to go through job interviews because we move unexpectedly. So one of the favorite questions is, tell me about your weakness, right? And that's one of those questions where if you are talking about your weakness, you have to couch it with why that weakness is a strength, right? So a similar thing in terms of making sure that not only do you identify the weaknesses and threats, but you also have a solutions for people you're asking for funding, as well as adoption and implementation. So we're going to do some group work, and I'm going to stop